Welcome to a brief pause. So, we take a moment to see what's going on in the pet world, covering a wide variety of pet related topics, including health, rescue, training, and the latest fashion trends. Today, we're going to talk about puppies. Do you have a new puppy? Are you thinking about getting a puppy? And if you got a puppy, are they coughing or is there weird stuff in their stool? Today, we're going to pick the brain of a very special veterinarian. I'm excited to welcome Dr. Lisa Lippman, DVM. She is one of the most followed and socially influential veterinarians in the United States. She is nationally respected by media outlets such as Dr. Oz, Inside Edition, and People magazine as a go to source for expertise in the pet health and safety realm. When not making house calls to treat some of the most influential pets in the world, she sits on the board of Animal Lighthouse Rescue, whose mission is to help the homeless dogs of Puerto Rico. Dr. Lisa is also the co host of a hugely popular podcast called We Don't Deserve Dogs. You should check it out if you're here listening to a podcast. Obviously, you like good podcasts. She does that with her boyfriend, comedian Richie Redding, and still finds time to devote her own dog, the incomparable Rhodesian Ridgeback Chloe. Get on her Instagram and look at Chloe, as well as everything else. Chloe's adorable. Welcome, Dr. Lisa.
Yay! Thanks for having me.
Yes. And so I said you did house calls, but right now things are different. I know you're doing more telemedicine these days, correct?
Yeah. So, yeah, since the pandemic started, I'm doing a lot. We've really pivoted, I think, so many ways in veterinary medicine to doing more tele-advice, tele-triage, telemedicine. I mean, all small nuances, but whatever you need, I think it's really becoming more and more available to people. And so, yeah, it's so important. So, yeah, they can get at me and schedule. And so, yeah, I have both like a monthly membership where you can have access to me 7 days a week for a monthly fee or a one-time call fee.
Yeah. And your company's name is Vets in the City. They can find you at vetsinthecity.com, correct?
Yeah, they can find me there, but email's great, Instagram's great, at Dr. Lisa Lippman. You can DM me if you're interested. I will see it.
Yeah,
Yeah,
people should
so any
definitely
any
check
of those
out
ways.
your Instagram. Her Instagram is full of information, but also super cute photos. And you'll see some of the interviews she's done on Dr. Oz and things like that. Today, I have her on. As usual, I'm usually always asking Dr. Lisa for advice on things. She's actually on call for my company, Luxury Groomer, whenever we have a strange question or see something funky. But lately, all of my calls to Dr. Lisa have been because of new clients with puppies, and they're coming from either off a plane or from out of state. And a lot of them are coming with kennel cough or worms or things like that. And these are things I definitely do know about, but based on their questions, I love to refer to Dr. Lisa just to make sure. And I never pretend or try to be a veterinarian or practice veterinary medicine. So anything I say, I would prefer to ask a veterinarian. So obviously, we've all seen there's a ton of puppies, quarantine puppies. It's going to be like the baby boomers. There's a puppy boom happening. But they're coming with all these things. And there's oftentimes, I'm seeing a lot of first time dog owners. So I really wanted to get Dr. Lisa on here and really ask, what are all these things that puppies can come with, say naturally from the mom or from the environment that they're in, things that are common to come from a puppy when they're still that young, freshly weaned age, and what should people be alarmed about? How should they treat it? Things like that. So the first question I want to ask are, what are some of the things that puppies do have? What's sort of natural to expect when first getting a puppy from whatever source that you're getting it from that they might be
Hmm.
carrying already?
That's a really good question. It's like almost a trick question. By the way, I just want to preface this by saying that you're my favorite human, and I'm there because we're here because I don't trust anybody else to touch Chloe's nails.
Thank you.
Yeah, and you're just magical with all the pets and just magic. But that is like an almost a trick question, I think, because I mean, anything can happen naturally, right? Death happens naturally. But I think one of the things that we see very commonly is parasites. So intestinal parasites like Giardia, Coccidia, roundworm, tapeworm, fleas, things like that. So I think that, if you get a puppy from a good breeder who really follows a good protocol, they probably shouldn't come with these worms. Sometimes it's very hard in like a kennel environment, just depends. So if they come with like maybe one, maybe to, but when they start having like multiple in the environment, I start to get very suspicious about, what kind of facility is this in? Certainly in rescues, they run rampant. I mean, just in puppies in general, intestinal parasites run rampant. And so, also being the medical director of a rescue, I see it a lot, in shelter situations and rescue situations. So that's pretty normal. That I think we just can't. Um, and that's okay. I mean, you do your first exam at the vet. You take a fecal with you to run it and make sure that they don't have any parasites in it. Every time your dog poops, it's like a small exam. You make sure there's no worms in it. Everybody looks healthy. So yeah, so those are some things. And then, like you mentioned, kennel cough, right? Any of the really infectious upper respiratory diseases.
Yeah, so that's the calls I've been getting. Unfortunately, a whole bunch, especially in the last couple weeks, is the kennel cough. So there's so many questions around surrounding kennel cough, right? So, can you pass it to humans? When should you be alarmed? That kind of thing. How easily is it to pass to dogs? I'm very aware that it's very contagious dog to dog. Luckily, in the house call environment, if we were to be at the house of a dog that has kennel cough and we weren't aware, we're not, they're not in a cage bank in a room breathing the same air as the other dogs. But yeah, people constantly calling me, telling me they have or have not been diagnosed, or they've been on antibiotics this many days, and they have questions. Everyone's home. So
Yeah.
can they pass it to kids? Can they pass it to humans, or vice versa? Can they pass it to dogs on the street? Although a lot of them are really, really young, so I don't know that they are supposed to be out on the street anyway. What's going on with kennel cough?
Yeah, so right, just like you mentioned, it's super highly contagious via aerosols. So I get this like respiratory droplets just being in a close environment. Definitely, you can pass it any which way from dog to dog for sure. As far as people go, so in in dogs, it's caused mostly by a bacteria. Now, usually, we're actually now calling it canine infectious respiratory disease complex or syndrome. It's actually it's a few viruses we think that come together that make kennel cough. So that's why
I
also,
hope they
even though
make
you
that an
get,
acronym because I'm going to forget that.
yes, CIRGC, we call it CIRGC. So, but uh, um, I lost my train of thought. It's coming back
Well,
to
a
me.
lot of people are concerned of whether they can pass it to children at home because
Right.
everybody's home.
Right. Oh, right. So what I was saying was it's a complex um it's a disease of multiple viruses, usually not just one, but Bordetella being one of the main culprits. So Bordetella bronchoseptica in dogs, in babies, it's called Bordetella pertussis. So there are two different strains of Bordetella. So and babies, you know it as whooping cough. So it's a very
Right.
similar type of thing, but they are two different strains of bacteria. However, um, and the different strains of bacteria tend to be pretty species specific, meaning they really just like to live in that species. They don't like to live in other species typically. If they jump to other species, usually they're like shorter lived or, less off. So typically a normal immune competent adult or human should not get Bordetella bronchoseptica. However, I mean, we can never say never, right? Theoretically, anything's possible. I would tell people to use good hygiene. And if you were around anybody who was immune compromised or like an infant or an elderly person, for sure, I would try to separate them as much as possible just to
So,
be on like the very safe side.
right. So it might be a good idea if someone's, a new mother, in their home, to keep the
Right.
dog kind of created in another room and just make sure to do what they need to do for at least what they need, 14 days of antibiotics, something like that.
Usually so kennel cough is viral, so there are some practitioners who will not treat with antibiotics, depends on how severe it is, or unless they feel like it's turning into a secondary bacterial infection. Most practitioners I know actually do usually do like a course of doxycycline, which is an antibiotic, and that's to help make sure it doesn't turn into, especially in very, again, young puppies who can be prone to having secondary complications, bacterial infections, pneumonia, things like that. Um, so most practitioners I know will put them on like a course of doxycycline. Usually, the doxycycline course that we do is 10 days. But I always say the cough can last a really long time. The cough can last like up to 2 weeks. But as long as the dog is eating and has good energy and is otherwise normal, then I am not overly concerned. Usually it's pretty self-limiting, and really it tends to be a disease of high mort high morbidity and low mortality, meaning that they get sick from it. Most of the dogs who come into contact will get sick, but really most of them do not won't die from this. So
Good. Well, that's definitely good to know because it is, like I said, we're hearing a
yeah,
lot about it. I also have never, in 21 years, heard much about dogs passing away from kennel cough. I
right.
do know that's why they get that Bordetella vaccine, and that's why that vaccine is required at facilities that have multiple
Right. Even
dogs
though
in
it's
the
not
same.
100% effective, right? And that's because it's again a multitude of viruses, and yeah, it's just not 100% effective.
Yeah, and I wouldn't doubt too that some of these are coming in. I'm hearing a lot of them coming in like on airplanes and things like that. I mean, I
Right.
think it's just one of those environments. If there's any other puppy on that plane
Right.
or whatever, it's gonna have it
Right. And
happen.
stress weakens the immune system. Who knows what kind of nutrition these guys are getting? So all of those factors combined just make them prime targets for things like, again, parasites and respiratory diseases.
Right. And so to add to that, we shy away from grooming them during that first, at least like, 10 to 14 days.
Hmm.
We don't want to, knowingly be exposed to that and take it to the next dog, but also that stress factor. I try to really reiterate to people that stress, especially with an upper respiratory thing, those little bodies are so delicate that
Yeah.
it just doesn't take
Yeah.
much to
It's
really
definitely important
aggravate
that they
that.
rest.
Right. It's not even
Yeah.
about the water getting them cold, it's about
Right.
stress can just
Right.
exacerbate anything.
Yeah.
Um, what is the protocol after bringing a dog home from travel because of being able to pick things up on the plane or just that travel or even the stress level? What's the best thing somebody could do with a young dog bringing it home?
Yeah, I mean, I think actually kind of just like you said, usually what I recommend to people, there are some people who like want to get the dog and then go right to the vet. What I say is actually give it a couple of days. I actually think it's really important for you to see what the dog is doing in its own environment. So is the dog, and because there's so much information we glean from history. So like I need to know like, is the dog eating? Is it having any diarrhea, vomiting, coughing, things like that? A lot of times these things just have to declare themselves, and we won't really know if you just bring them in. Like, yes, we can do an exam. If the dog looks sickly, for sure bring it in. But if the dog looks otherwise healthy and you expect it to be a healthy puppy, I usually say wait a couple of days, maybe like 3 to 5 days to bring the puppy in, to just make sure they're doing all their normal things so that we can troubleshoot that together.
Yeah, and I want to add to that too that even if the puppy's acting like a puppy, really happy,
Hmm.
running around, doing all their thing, it's just that again those tiny bodies that any added
Yeah.
thing can really turn
Oh
that
yeah,
upside
they're
down so
so tiny.
quickly. Yeah. Can turn it upside down so quickly. What else do you advise? Soon as someone's coming home as a veterinarian, what are the top items they should be having at home for their brand new puppy?
Yeah, well, let's see, just off the top of my head, I mean, you don't need a ton, right? So I would pick a food, make sure if they come with another food, you switch slowly, like over 5 to 7 days. So I
Oh,
like to
yeah,
do like
that's super important. Yeah.
first day, like 90% old food, 10% new food. Day two, 75% old food, 25% new food, and 50-50, and so on. So switching food, knowing what food you're going to feed, switching slowly. Obviously, then having bowls for them, deciding where they're going to sleep. Um,
Do you
and
think that somebody should start a relationship with their veterinarian before they knowingly get a puppy? Should they find somebody first and then book that appointment for a week after arrival? How does that typically work best?
Yeah, that's a really interesting question, actually. I have had a few people who that's exactly like what my tele advice service is for. And so I think it's really helpful for people to come to me actually when they get a new puppy, and before they get the new puppy even, so that we can talk about all the things that they need to have in place. Prior to having the puppy, usually people have so many questions, and puppies are so much. I mean, my first puppy appointments in clinical practice, like I would need an hour, because people have so many questions and there's just so much troubleshooting, especially the first year of a puppy's life. I would say like you're gonna need me a whole bunch for like the first year. Sign up for my, my yearly um, commitment program, but then like I probably won't ever talk to you again. Usually after the first year they kind of get it figured out. But yeah, so I think that's really great. That's exactly like what a tele-advice service is for. It's like, feels a little strange, I think, to probably go into the vet for an appointment without a dog, but that's like really the perfect thing that tele-advice is for. And so, yeah, we can talk about that. So things I usually talk about them, besides getting ready with all the things that they need, collar, leash, bowls, food, not that hard, but training, pet insurance, these are all really important things.
Oh,
So
yeah, I forgot about that. Like, you probably want to have your idea about what you're going to do with pet insurance before you start the process of paying your veterinarian in that first year, because you're going to have a lot of vaccinations and appointments and
yeah.
potentially the surgery or procedure of a spay neuter, all that fun stuff. So it's like, get
Yep,
it,
exactly,
get it
exactly.
beforehand, do your research beforehand. Well, thank you so,
Yeah,
so
well,
much.
because
Oh, I was
any
going to say,
pre-existing conditions, yeah.
what were you saying?
You want to get it before the pet has any pre-existing conditions, and that can be anything. Like even like if they're diagnosed with a parasite, that can be considered a pre-existing condition. So just get it. I mean, it's so, and also pet insurance will never be cheaper than it is now. Like pet insurance rates will constantly continue to rise. So if you can lock something in or get something in at a cheaper rate, then you're better off.
Well,
So
that's really good advice. I had never heard that even the parasite, which so many puppies have, or can even just sort of get really easily, if you do end up taking them out, they can get it. Can't they get them sometimes just in the soil and things like that, or like from
parasites,
another
yeah.
dog's? Yeah, from another
Oh yeah.
dog's. Yeah.
hmm Well,
Um,
I mean, it's poop. Mostly, most small intestinal parasites are fecal oral, meaning from poop. But poop is this is one of my favorite things. Poop is everywhere. Like you poop. It's not just like the poop itself. There are tiny little particles that just go everywhere that live in the soil, that are really hard to get rid of, and so that's when that can happen.
Now, I wanted to ask you something. Um, what's your feeling on the leptospirosis vaccine?
Yeah, I try to really tailor it to my patients. I always say so lepto, first of all, is an awful, nasty disease. It is transmissible from animals to humans and vice versa. It's spread through urine. So basically, um, you have to ingest a urine in order to get it. But it happens. It lives in standing water. So in like rivers, lakes, puddles, streams. So if you are and mammals pass it like rats in New York City, rats carry it like everywhere. So if you are in either like a city that has a ton of rats or in like a suburban area, that has a lot of like wildlife, it may be something you want to consider, especially if your pet is, especially if your pet, hi Clau, especially if your pet is, really like what loves like puddles, rivers, standing water, or licks like other animals pee. So I think that, it used to be one of the more reactive vaccines. It's not considered core, meaning like not every pet needs it. It's really based on, again, their lifestyle and where they go, and we tailor that. Now that being said, I once in practice, I had one of my bosses had a patient who was like a tiny little dog who literally like its feet never touched the ground, and somehow it got diagnosed with lepto. So you can never say never. Everything we do is a risk. The vaccine is a risk. Not getting the vaccine is a risk. I give all my patients a choice. My dog is not vaccinated for lepto, and that's because she's a small vaccine reactor. Does that mean she would have reacted to lepto? No, but she also hates water. She stays away from it. It was a risk I took. Lepto also is not effective against all types of lepto. So the lepto covers about what we call 4 different types of serovars or different types of lepto. There are 8 different types. The vaccine that we give cover about 4, so they still can get it. But yeah, so I would say most dogs in New York City probably get it. But again, it
Yeah,
really
I've heard a
depends on
lot
their
of
lifestyle.
conflict, and I think that's one of the things with new puppy owners is sometimes the trainers giving this advice. Sometimes even the pet sitter or the walker is giving this advice, and then sometimes the vet is giving this advice, and then the breeder's giving this advice. But I had not heard that lepto used to be considered reactive. It's getting a little bit better these days.
Yeah, exactly. So I do think that the manufacturers have gotten a lot better. We know that the more vaccines we give at once, the more likely they are to have a reaction to it, theoretically, right? And then we don't know what to. So I like to, when I give lepto, if we can break it up, that's great. Some people prefer to just get it over with. Again, most of the time the dogs are fine, but all of the reactions I have seen, and I have seen it a handful of times in my career, um, is really to lepto. But all the dogs lived. Usually it's like severe facial swelling, collapse, like low blood pressure, things like that. Um, so
That all sounds
so
scary,
yeah,
but
so
like, what would be your guess on the percentage of dogs that's happened versus even, I don't know that you could off the cuff do this math, but versus the amount of dogs that would be affected negatively by getting lepto?
a very, very small percent, a very small percent. Like I said, I think it's, I've been practicing for years, but I've been in veterinary medicine for a lot longer than that. And I've probably seen it, I don't know, maybe 10 times, maybe once a year or so, about sounds right. Depends how often you practice,
And
I
you
guess,
spent a
but
good amount
maybe
of time
around
in
there.
emergency medicine as well.
Right, right,
Yeah.
right, exactly.
Yeah. I
So
mean, it's
I've seen.
oftentimes, I would
and
assume,
and and a reaction can happen to anything, right? But
right?
still, usually, typically, they're very safe. And also, I have never seen a pet die from a vaccine. I'll say that I've never seen that happen. I've heard, I have some colleagues who have had that happen too, but I've never seen it. So, and
Well,
thankfully,
that's
I
good
don't
to
think any of
know.
my friends have either.
Yeah.
Yeah, and I'm friends with a ton of veterinarians, and I feel like I would have heard that. I actually haven't. I think I
Yeah.
heard one story from a professor, and that was pretty much that. So.
That's good to know, because just like we were talking about, be careful with these tiny bodies. Of course, the owners are trying to be careful with these teeny tiny bodies as well,
Right, right,
putting
right.
all this stuff in them, and it looks scary, the amount of liquid that goes in that dog. And it's like the same for this dog as like a Saint Bernard, it looks like, and
That's right.
it looks kind of crazy, but that's really good to know. I hadn't actually heard that it had softened a little bit, because I've been doing this so long that sometimes I need to check in and and know the new
Yeah.
stuff as well. Well, thank you so much for being here and answering some of our questions.
Yeah.
I'm sure I'm going to have even more in the future. As these puppies get older, the people are going to have more questions, and we can ask you even more things.
Yeah.
Thank you for taking the time being here with us today.
Yeah, of
Everybody,
course.
check her out.
Uh,
Check out the Instagram for sure, and that will lead you to some of the other things. Obviously, you're already here on the podcast. Check out the podcast, We Don't Deserve Dogs. Richie is hilarious, and Lisa's amazing as well. And they get some really amazing guests on there. You can see the roster in the descriptions, and check her out for the telemedicine and all that good stuff at vetsinthecity.com. And we will catch up with you later. Thank you for listening, and thank
yeah,
you for being
thanks
here,
for
Lisa.
having me.
Bye.
Yeah, thanks so much, guys. Bye.
Thank you for listening, and follow us for more wherever you get your podcasts. Also, check us out on Instagram at A Brief Pause.